Hello, I'm Dr. Perry Jensen. I live in Temecula. I work at a Sharp Hospital in San Diego. I'm a pathologist and I did my medical training at University of Iowa College of Medicine. And I did my residency training for 4 years at UCSD Medical Center in San Diego. Then I did an additional year of fellowship training at University of Iowa. And since then, I've been practicing for 22 years. I practiced at Palomar Medical Center for about 4 years, and I worked at the Rancho Springs Medical Center. I guess they call it, I'm not sure what they call it now. Part of the Southwest Healthcare System, something. I worked there for a few years, and now I go to San Diego.
Do you do experimental work on the side or any research for improvements in medicine?
I don't. I personally don't. There are, as most medical specialties, they'll be divided into academic and what they call private practice. So I'm in the private practice where I would work. I work at a hospital. It's a not-for-profit hospital, but it's not affiliated with a university. Like UCSD Medical Center is a university medical center. So many of the pathologists that are employed there will do research on the side. They'll split their time between, UCSD Medical Center. They still have surgeries and dermatology clinics, et cetera, just like any hospital. But those institutions, since they're affiliated with a university, will hire people that are also interested in doing research, and they will carefully select people like that because they want to maintain the reputation of the institution as someone who is doing research. Whereas, like the hospitals in the Temecula Valley and probably most of Riverside, well, in our general area in Southwest Riverside County, and then most of the hospitals in San Diego are private practice, and so they're not doing research. They might participate in free research projects here and there, but they're primarily is taking care of the patient using you know information that's standard of care, current standard of care. Most training programs are at university hospitals. So if you go into a pathology residency, you certainly, they will encourage you to do research, and there are people there who will help you with research. But then when you comes time to enter practice, then um, generally then you make a decision: do I want to, spend some or all of my time doing research, or do I want to spend my time in private practice? So pretty much any residency that you enter, you'll have that option.
Okay. Did you know in high school that you wanted to be a pathologist or a doctor?
No, I was interested in biology in general, but not specifically medical. I was more interested in um, like this is back in the 70s when I was in high school, and that was like when ecology was like a new word, and so the whole a new interest in how the environment works, keeping, caring for the environment. All those were relatively new ideas in the 70s. So that's the kind of thing I was interested in.
Um, what did you major in undergraduate school?
Undergraduate biology, major in biology and a minor in chemistry. I took, now you'll, then they had a pre-med. I took mostly the same courses as the pre-medical students did. They didn't have it divided into subspecialties as much as they do now. I mean, now you have a pre-med curriculum or pre-dental curriculum. It can get very specific. Mine was general, just general biology.
When did you decide to become a pathologist?
Probably about halfway through my medical training. The first couple of years of medical training is more of a general, anatomy, physiology, biochemistry, and then when you start rotating through the different specialties, um, then you start to. So basically, like my third year when after I rotated through the various ones, you'll find specialties that match more of your interests, your personal style, your demeanor. If you want to see patient, like for me, pathology is like a pathology or radiology. You're a consultant to the doctors who are physically in contact with the patients. I'm more, I'm in the laboratory, or a radiologist is in the reading room, where you don't have as much direct patient care.
What were the challenges of residency?
Challenges of residency. The thing that's good about a pathology, a lot of the challenges you'll hear from other specialties are just the grueling hours. I don't know, this is, you know, in the 80s when I was in residency. Maybe it's changed. Maybe they're making more efforts now to change it. But most specialties, it's just the grueling long hours with no sleep. You'll hear that from, surgery and medicine. In pathology, it's more of, you know, sunrise to sunset sort of duties. So that's the good part about it. The challenge is, I mean, some people don't have the personality where you just want to, some people like the patient care and that's what they want to do. And so for me, I enjoyed it. I guess I don't know, I can't think of anything that was a particular, challenge.
So what were the exciting parts of residency?
Well, the interesting parts are, well, the thing that suits my personality is I'm more of the type of person who you sit, you don't sit alone in a room. It's not that stark, but it's a lot of you have the books, you have the challenges of the cases that are on your desk, and so you're given a lot of time to in a quiet room sort through the challenges of dealing with the specific case that you're in, as opposed to in a clinic when you may be moving quickly from room to room, and the environment's constantly changing. You're seeing a lot of people, working with a lot of ancillary staff, whereas in a pathologist you're more likely to be in you have a smaller number of people that you work with. You work more at your own pace. I mean, you may have a lot of work to do. I guess the challenge is having the big volume of work to do. So it's not like you're just, sitting around, taking your time doing things. You have a big volume of work that you have to do, but you're required. You work at your own pace, as opposed to if you're in a clinic, you have, your 3:15 is here, you got to go take care of it. Now it's your 3:30 is here, you're forced to keep up, and you have.
What were the most memorable cases you have had?
Yeah, it's not. It's a very, when I think about back on it, my work seems very routine. I mean, I do this so much of the same thing over and over. It, you know, you wouldn't you wouldn't find it interesting or memorable. Um, the things that you remember are the people that you work with, that you have contact with, maybe the surgeons and clinicians that you work with. Um, some of the cases, you run across cases that are really unusual and you find it particularly interesting, but it's difficult to describe them to someone who's not in pathology. I guess one of the more interesting cases I had was an autopsy on someone who came. So I don't do forensic autopsies, but you do hospital autopsies where someone dies in the hospital and it's not under suspicious circumstances or criminal circumstances. But a woman came to the emergency room and died within a few hours, and it turned out that she had a very unusual septic bacterial infection from Clostridium, which is extremely unusual. Draws many people to pathology, especially someone who wants to raise a family or spend a lot of time with their family, because the work hours are more regular. I'll go into pathology with the idea that it is more of a regular hours and that you have more time on the side. Although what I was trying to say is that other specialties now are tending more towards having those opportunities also.
What are any annoying or irritating aspects of being a pathologist, if there are any?
Irritating or annoying? Well, you are required to, as I was talking about the management part of the laboratory, you are required to manage other people. And they are um, there are people that are trained as laboratory techs, and they can be large groups of people. And so, for someone like myself, the management part of you're required to manage large groups of people, which in medical school, at least when I went through, they didn't train you in management skills. It's more like a business management aspect, and you're not trained in running a business, in running supervising large groups of people. And so that can be very annoying. Number one, because you're not trained in it, and number two, you don't particularly like it. And there are, and when you're managing a lab, there are a lot of regulations, government regulations that you're required to meet. And so then you may be inspected by someone who is not a physician, and it can be difficult for them to understand the day-to-day practice, why you do what you do. They're trying to follow the letter of the law, and so they may be requiring you to do things that you recognize as not important, not useful. So that can be annoying. It can be a big headache dealing with the business aspects, especially in environments where things are more competitive now. You have more managed care. You can't the days when you just performed a service or ordered a test and the government paid for you or paid for it or insurance company paid for it, those are going to be short-lived. So there's those aspects can, particularly when you're not trained for them, yeah, those can be really annoying.
So on the other end of the spectrum, what are the most rewarding aspects of being a pathologist?
Rewarding aspects, you don't see the when you don't have direct care with patients, you don't so much see the direct results of the work that you do, and so you're more the rewards you get in those aspects are more indirect. Um, you're not directly thanked by a patient, like maybe an oncologist every day is going to be, directly thanked. So the rewards come from the knowledge that you're doing a good job. Um, you got to kind of pat yourself on the back because other people aren't going to do it. And then if you enjoy the work that you're doing and you're able to have some, as the question before, a more of a private life outside of work, that can be very rewarding.
Okay. Do you have any regrets or things you would have done differently on your path to pathology?
Well, sometimes I question going into the medical field at all. Um, when I was finished with my undergraduate degree, I was considering getting a PhD in genetics, which was then a relatively small field compared to what it is now. And with the research, with the pathology or any physician, you have every day there is a certain amount of work that needs to be done and it has to be done by the end of the day. In research, I think there is more room for having periods when you work very hard, with like a creative impulse on something, and then times when you may have more downtime. So sometimes I think that would be better suited to me rather than the more intense day-to-day pressure of the day has started and before 6 o'clock you need to have all of these things done. Yeah.
Have liability issues ever affected you, or do they currently affect you?
Actually, pathology probably has less liability problems than most other specialties. Although just my own um, personal experience was involved in a law, basically a nuisance lawsuit. It's the only lawsuit I've been involved in where, someone basically decided to sue everyone that was on the case caring for their mother. And they just went through the chart and picked every doctor's name and they named us all in a lawsuit. And that happens to other specialties a lot more than to me. And but despite the fact that there was no malpractice involved, personally for me, my insurance company paid $100,000 defending against the suit, and um, it's a huge waste of resources, a huge waste of time. Um, and so you're probably talking to other physicians, you'll get more of an idea of that. But that's one of the certainly downsides or annoying sides of being a physician.
So what is the general annual salary of a pathologist?
It depends a lot on the area of the country that you're in. You'll find, and then that's going to, it's going to change in the future. It's constantly evolving, constantly changing. So the things I tell you now may not be the same as by the time you get through medical school. Um, if you're in the Midwest, if you're in Texas, areas where there is not as much what they call managed care, where you have areas that don't have managed care, they have a lot of Medicare patients. You can charge usual and customary fees and be paid. In a competitive area, geographically desirable like San Diego, a lot of people want to live here. There's a lot of competition for physician services and lot of large medical groups who are negotiating on behalf of the patients. So you make less money in an area like San Diego. So the range currently, someone with good training would start between $150,000 and $200,000, and then the upper range could be anywhere from $300,000 to well over $1 million if you're in a very busy practice that you're working very hard and you're in an area of the country where the compensation is higher. But a lot of it has to do with, you're going to be in a group practice. I mean, there's almost no such thing as a pathologist in solo practice. You can get with a group of people that look, we want to make as much money as possible. We want to work as hard as we can, as many hours as we can get in, and you'll make more money. Or you might get with a group of people that say, look, we want to, have a decent living, but we don't want to spend every waking minute working. And in that case, you can pretty much decide the number that you want of. If the profession doesn't monitor itself and make sure that it's turning out quality work, and it becomes a public issue, then the government steps in and starts telling you, you guys weren't doing this right, so now we're going to tell you how to do it. And that's what happens when physicians get greedy. They start cutting corners, and they're not doing the best job possible. If you're not going to police yourself, then the government's going to step in, and if it becomes a public issue, the government will step in and police you. Outside of that, it's certainly the government is the biggest payer for healthcare, and that's probably only going to increase in the future. So basically, the government indirectly decides how much you're going to make. The government decides how much they pay for a test, and that pretty much decides how much you're going to be paid and how much you're going to make. If they had went to a one-payer system where the government pays for health care for everyone, regardless of your age. I mean, the government pays for Medicare, Medicaid, which are huge, huge programs, as probably everyone knows. If they expanded that where the government is the one payer for all tests, then the government is going to decide, basically it's going to decide how much physicians make. And I don't know, in 20, 30 years, who knows, the government, for instance, in Britain, I don't know that much about health systems in other countries, but I think for instance, Canada and Britain, many more physicians are actual government employees. So that may that maybe what happens in the future where you actually become an employee of the government.
All right. Well, thank you for the interview. That was pretty much
Certainly.
it.